I'm equally conscious as my current role as CEO of the HSE, what we have been through and what the public have been through in the past 18, 20 months now of this COVID-19 pandemic. And I'm particularly aware and understanding of the rapid solutions that we had to put in place over a very short period of time to protect the public throughout COVID. And certainly at the very early stages of that, we knew that we had to work with many of our enterprise, ICT and network partners. I'm very pleased that Air, being one of those very key partners who've worked with us throughout that period to put in solutions to protect the public. And one of my experiences throughout all of that was, in particular, how sometimes we keep focused on the big strategic network ICT solutions for business and for customers, and they are important. But my experience over the past 20 months were some of the tactical solutions that we put in place gave us the greatest benefit of protection for the public and for our patients. And I could just relay some of them in simple terms. We had to very quickly create a connectivity between many of the HSE systems and other health practitioners like GPs and pharmacies. We had to connect our systems in such a manner that at the very early stages, as the public came through to GPs for their healthcare or for testing for COVID, that they could be referred in a very simple way from the GPs for testing, and indeed to get their results in a simple way through technology, and indeed for us to be able to contact trace people in a very simple way. So they sound like very simple ICT and network solutions, but they were very effective for us, and they were one of the ways in which the public got a lot of trust and confidence from the HSE, because we were able to put in very quick solutions through our network and ICT environments. Equally, I just want to make reference to the vaccination programme that we've been engaged in, which is, as of today, once again recognised by Bloomberg as the most effective vaccination programme across the world. And again, we don't take that lightly. There are a couple of reasons why that has happened. Firstly, again, the role that networks and technology solutions put in place. For us to be able to facilitate the public to be able to register for their vaccine, be called for their vaccine, being given a second date for their second vaccine, and for them to get all of the relevant information to support them in getting that was a really important network solution that we had to put in place in a very short time frame through our strategic partners. And I reference that because that equally is what gave the public such good trust and confidence in the vaccination programme. And one of the reasons that we have the highest uptake, one of the highest uptakes in the world of our vaccination programme, is because people got strengthened trust and confidence from our public messaging, but equally from the experience of everybody coming through for vaccination in a very safe way. So I use those two examples to demonstrate how we have seen the role that technology, enterprise and solutions, and sometimes simple integrated network solutions, can provide huge benefits to all of the people, the customers, and in our case, the patients and the public that we serve. And there has been a third benefit for us, which has been the utilisation of effective data, which I know is very important for the new merged business of Air Evo. Because using data from both the vaccination programme and the testing and tracing programme is helping us to give greater insights into areas, A, where we may have a lower uptake on the vaccination programme, correlating that against where we are seeing highest case numbers, and able to help us focus our communications into those remaining smaller elements of the population that need to come forward for vaccination. So I say all of that just to give you my brief insights into how technology, networks, ICT solutions have played a very big role throughout this pandemic.